Hey you guys, my name is Jason Schuster. I'm a doctor of physical therapy. I own Intricate Art Spine and Body Solutions. It's a continuing education company. We teach other doctors how to do a couple things, including dry needling, joint manipulation, manual therapy, and nutrition. And we have courses and certifications in all of those areas. Check us out at intricateartseminars.com. I just wanted to talk to everybody today about the difference between our dry needling 1 and 2 classes. So the difference between Intricate Art Dry Needling 1 and 2 primarily is that in Dry Needling 2 we spend a lot more time on the hands, feet, and face, right? So in Dry Needling 2 we cover the entire head, the face, the suture lines, the ears, right? How to do vagus nerve stimulation, how to treat for palsies and stuff like that in the face, neuropathy in the hands and in the feet, right? And we also include other areas in the course. So we do cover some of the muscles in Dry Needling 2 that we cover in Dry Needling 1. However, there's numerous ways and numerous approaches to get some of the muscles in the body. So both Dry Needling 1 and Dry Needling 2, you guys, cover some parts of the entire body, right? So we go over the most dangerous stuff in all of our dry needling classes, and that doesn't take very long, right? So we go over the lung field. There's only a couple of thoughts that you need to keep in mind as far as how to keep that safe. We go over the multifidus, the scapula, stuff like that, and then we go over different things in different classes. But as far as overall order of operations in the courses goes, in Dry Needling 2, we primarily cover the hands, feet, and face, including some cervical stuff, some sacral stuff, right? And then in Dry Needling 1, we go over everything else. So basically, between Dry Needling 1 and Dry Needling 2, we cover every needleable muscle in the body that we can needle safely, aside from some of the pelvic floor muscles, right? And then we have our pelvic floor class where we cover the pelvic floor, which doesn't just include pelvic floor muscles either. So that class, because we use our system throughout all of our classes of an autonomic nervous system centered approach where we directly treat the autonomic nervous system instead of the specific condition, we're always utilizing the entire body. However, it is helpful in pelvic health to be able to treat other stuff to target the autonomic nervous system. So we go over that in that class. And then in Dry Needling 3, instead of going over how to target specific structures, in Dry Needling 3, we go over how to implement dry needling in a more clinical setting. So instead of going over like how to needle the bicep, we go over how would you treat a post-rotator cuff patient in the clinic using our approach with the autonomic nervous system, how to treat the specific structures, how to incorporate everything together. So that's more of Dry Needling 3. And then we also have a new course, you guys. It's called Advanced Clinical Dry Needling. So for a couple of states, we've had a bunch of clinics ask if we could make basically Dry Needling 3 and Lumbopelvic Dry Needling into the same class. So instead of a 2-day class, so Dry Needling 3 and Lumbopelvic Dry Needling are 2-day classes. They're 16 CEUs each. Dry Needling 1 and Dry Needling 2 are 3-day classes. They're 27 CEUs each. And then Advanced Clinical Dry Needling is also a 3-day class. So it's basically Dry Needling 3 and Lumbopelvic Dry Needling smushed into a 3-day course. So that's two 2-day courses smushed into a 3-day course. So it's slightly different, but it's basically Dry Needling 3 and Lumbopelvic joined together. And in that course, we specifically go over how to treat the lumbopelvic structures and the pelvic floor structures without exposing the genitalia, which is something that you can do if you know what you're doing with needles, which is one of the reasons I really think it opens up a huge door for both practitioners and patients to go in and get that type of treatment or perform that type of treatment, because one of the biggest barrier to that, as far as I can figure out, is just the invasiveness of a lot of pelvic floor treatment. Not that it's like a bad thing or anything at all, but that is a turnoff to a huge amount of practitioners and patients. And with needles, if you understand what you're doing properly, you can treat and resolve a huge amount of pelvic floor problems much better than you can without needles, and you can do it without the so-called, invasiveness or uncomfortableness of what typical pelvic health treatment is thought to be, right? So it's very, very good stuff.